there was a recent publication from the German newborn screening pilot project in 2019. And this was interesting. There were over 165,000 newborns that were screened with an incidence of about 1 in 7,000. Perry told you at the beginning that we think about an incidence of 1 in 6,000 to 1 in 11,000. That's sort of what historically we've said. So this is interesting. And that the patients that were identified, particularly with the 2 and 3 copies in this pilot study, were treated urgently. Now, there was a follow-up that was done just this year, and over 278,000 patients were screened. And the incident was about the same, still about 1 in 7,300. Interestingly, about 40% had greater than or equal to 4 SMN2 copies. And that is really interesting in terms of the statistics that we had seen a little bit earlier. So we have to look at how these numbers are going to be changing over time. And this does have implications for therapies. As we institute newborn screening in our respective states, there are sometimes unexpected results. Colorado and Wyoming are screened together, and we have together combination about 80,000 deliveries. All of these newborn screens come into Children's Hospital Colorado, so we see all of the babies that are screened. And as I mentioned, right now, based on the higher number of babies that we expected that are positive, our incidence is about 1 in 4,000. In our newborn screening program, the babies are seen within 24 hours of identification, and our goal is to have treatment accomplished within 21 days if parents desire treatment. So that's a little bit about what's happened in Colorado and Wyoming. Claudia, New York has been screening for a longer period of time, and you screened over 200,000 patients, I think. Will you comment on what your impressions are?
So in New York, after that 1 year, there were 8 cases out of a total of 225,000 plus children tested, and that led to an incidence of about 1 in 28,000, which was 2.5 to 4.7 times lower than we expected. I think part of that has to do with the fact that there are ethnic and racial differences. When you compare it with the German, it's a very homogeneous population that has a very stable, and we know that among Europeans, the rates are higher. But the rates among Latinos are much lower. They're about 1 in 55,000. Among African Americans, it's 1 in 48,000. So I think we are seeing a combination of factors that has to do with the wide racial and ethnic distribution that a cosmopolitan city like New York has, and also dealing with some of the aftermath of early identification because of what's being done by the American College of Obstetrics and Gynecology. Our program is a little different. We get newborn screening plus our SMN2 copy number, and we do try to treat them as soon as possible, though COVID has gotten in the way of being expeditious because things are a bit delayed, especially, for example, obtaining something as simple as a birth certificate now takes a little longer, unfortunately.
And Perry, California, my understanding is just started recently with newborn screening. Can you tell us a little bit about that?
Yeah, so we've only been screening for the past 3 months, and so we're a little more bureaucratic perhaps in California. It's been interesting. We've talked through this a lot. I guess maybe we did a lot more talking about it, but the idea is to have a diagnosis, at least based on the screening test, by the 7th day of life. And typically what happens is they contact the pediatrician and activate one of the SMA centers so that the pediatrician who's taking care of the newborn will know what the options are. And the pediatrician may or may not choose to work with the SMA specialist that's been chosen, but that there would be a second sample that would send, so a separate phlebotomy sample that would be submitted for confirmation of the diagnosis, and that on the second sample, SMN2 copy number would be obtained. And the goal would be to have a definitive diagnosis along with SMN2 copy numbers by the end of the second week of life. And the goal, actually, among all of the SMA specialists that were involved and geneticists that were involved in this project, was to be able to institute therapy within the first 3 weeks of life.